Where are we when it comes to kids and COVID-19? As of today, more than 10,000 cases are being traced back to those under the age of 20 here in Tennessee. That's approximately 15% of the state's cases. 3 of those patients, we should point out, have now died. Although we are unaware of where these kids got the virus, the Tennessee Department of Health says child care facilities have not been significant sources of spreading COVID-19. Reporter Erica Francis now from Nashville shows us this may be a glimpse of hope now for parents as their kids get ready to head back to school.
It's not zero, but it's pretty darn close to zero.
Close to zero when it comes to COVID-19. It's like music to our ears. This stat coming from Dr. Alex Jahangir Tuesday in regards to the amount of cases in our region connected to a child care facility. The total number, 0.9.
I have been working with a couple of daycare centers to have them have a preparedness plan.
Dr. Michael Caldwell knows of at least 2 daycare facilities in Davidson County where at least 1 employee tested positive for COVID-19. Statewide, the Tennessee Department of Health identifying a few clusters of illness associated with such facilities, but says there was only 1 with 5 or more cases.
I think in general, we should be reassured that children tend to do better than adults. They have milder symptoms and they tend to recover for the most part just fine and quickly.
Dr. Caldwell says a total of 1,228 kids aged 1 month to 17 have contracted coronavirus in Davidson County. 612 of those cases, as of Tuesday, from kids 10 or younger.
Most of the children are doing quite well. 95% of them have remained outpatients with fairly mild symptoms.
Dr. Ritu Banerjee, associate professor in pediatric infectious diseases at VUMC, says 5% of those children have had to be hospitalized.
Those that have been hospitalized tend to have underlying medical conditions.
Dr. Banerjee hasn't treated any kids with COVID-19 personally, speaking instead to several over the phone. She says about 70% of children infected came in contact with an adult in the house or community who tested positive.
We also think that children could be a risk for spreading, but we're still learning about that.
Leaving doctors to figure out what came first, the chicken or the egg.
Now, we asked the doctor if she would feel comfortable placing her kids in a group setting like school. She tells us that she definitely believes we could potentially send kids back to school safely, but would feel better if the rates were a little bit lower in terms of community transmission.
As kids wait for